All right, I'm gonna start off my head to toe assessment by collecting my supplies. I have my stethoscope, my pen light, a Q-tip, tongue blade, some hand sanitizer for the smell test. I have a newspaper for our vision test and some gloves. So I'm going to start off by introducing myself. My name's Katie and I'm gonna be your nurse today. We're gonna do a head to toe assessment, okay? We're just gonna check that we have baseline and everything's working. So I'm going to provide for some privacy and then do hand hygiene and then put on my gloves. And now I'm going to double check identity. So can you tell me your name and date of birth?
Sladine Malbranch, 8/31/1996.
All right, perfect. And do you need to use the restroom?
No, ma'am.
Okay, perfect. And now we're going to do a general inspection of the patient. So the patient looks like she has some good posture, she's comfortable, well nourished, and clean. And so next we are going to ask, are you in any pain today?
No, ma'am.
All right, perfect. And we're going to continue with our vital signs. We're going to do the blood pressure, temperature, oxygen, respiratory rate, and pulse. So after that, ask the patient to state your name.
Sladine.
All right, and where are we?
We're at school, FSW.
Okay, and who's the president?
Donald Trump.
All right, perfect. And I would document that my patient is awake, alert, and oriented. I'm going to start by inspecting the head, and I'm going to look for any lesions, any infestations, any abnormalities. And the head looks symmetrical and even and good. And can you take your glasses off for me? And I'm going to palpate the sinuses. So does this hurt?
No, ma'am.
Any pressure here?
No.
All right, perfect. And then I'm going to start off by doing my cranial nerves. I'm going to start by doing cranial nerve 1, which is the olfactory, which is your smell test. And I'm going to have the patient occlude one of the nostrils and close your eyes, and you're going to tell me what you smell.
Hand sanitizer.
All right, perfect. And on the other side?
Hand sanitizer.
Okay, great. So that nerve is intact. And next we're going to do the ocular nerve, and that's cranial nerve 2, and we're going to test for her vision. We would do the Snellen test for far distance, and you would put it 20 feet away. But right now we're going to do the Rosenbaum test with this newspaper. I'm going to have you hold this 14 inches in front of your face. And can you read that last line for me?
Yes. Learning standard documentation increases your value to publish when you're writing for publications.
All right, perfect, and that's correct. So that nerve is intact. And next we're going to do nerves 3, 4, and 6, which is our oculomotor, trochlear, and abducens. So I'm going to use this pen light and have the patient follow it, and we're going to do the 6 cardinal fields of gaze. So just follow this pen light for me. And she's having no trouble doing that, no abnormalities or abnormal movements of the eyes, which is good. Now we're going to check for the abducens, so just follow this pen light for me. And her eyes came in at an inward gaze, so that's good. Now I'm going to have you look straight ahead while I check your pupil reactions. Alrighty. And good. Alright, so I would document that pupils are equal, round, reactive to light, and they accommodate. So next I'm going to move into the trigeminal nerve, which is the facial sensation. So I'm going to first start by having you clench your teeth for me. All right, perfect. So that's intact. And then I'm going to have you close your eyes, and you're going to tell me where you feel a sensation and tell me if it's soft or if it's hard, okay?
Soft, and that is my right forehead.
Okay.
Soft or hard, and that is my right cheek.
Okay.
Hard, left forehead. Soft, left cheek.
All right, perfect. So that nerve is intact. And then next we are going to do the facial nerve. And can you smile for me? All right, can you make a bubble in your cheeks? Can you raise your eyebrows? Squint your eyes? And frown. All right, perfect. So that cranial nerve is intact. And then next we're going to do the vestibular cochlear nerve, and that is your hearing. And there's 3 tests. You can do the whisper test, the rhyme test, and the Weber test. Today we're going to do the whisper test. I'm going to do this by occluding one of the ears and whispering 2 words to her, and I'm going to have you repeat those words to me, okay?
Cat, dog.
Okay.
Pink, purple.
All right, perfect. So she got those, right? The next is the glossopharyngeal nerve, and that is movement of the tongue. And so I'm going to have you open your mouth and say ah for me.
Ah.
All right, perfect. And the uvula raises up, which is normal, and that's great. And then the vagus nerve is nerve 10, and that's if you swallow and if you can speak normal, which you can. There's no cracking of the voice or anything. Okay, and then the tongue movement is the hypoglossal nerve. So I'm going to have the patient stick your tongue out for me, move it side to side, up and down. Perfect. Now I'm going to do the spinal accessory nerve, which is nerve 11. I'm going to have you show your shoulders against resistance. Great. All right, so we're going to move on to the upper extremities, and what I'm going to do is test for temperature of the skin. It's all uniform. Moisture is normal. Okay. Now I'm going to palpate for the radial pulses. Bilateral ×2, and then the brachial are also bilateral ×2, which is normal. And then I'm going to move on to the chest. I'm going to start off by doing the carotid arteries. I'm going to palpate one side at a time, and then I will auscultate. With the bell of the stethoscope. All right, and then I'm going to check for the lymph nodes, and there's no swelling. Everything is symmetrical. Tracheal is nice and in the midline. And then when I'm inspecting the chest, I'm looking for any abnormalities, any skin tears, or any lesions. I'm going to check for the turgor, which is normal. And then I'm going to start off by doing the 5 points of the heart, and I'm going to start with the aortic, and then the pulmonic, the Erb's point, tricuspid, and then mitral, which is the apical pulse, and I would listen here for a full minute. Typically, when I'm doing a chest assessment, I would do it with the patient's chest exposed and not on top of the skin. And I would listen for a full minute on the apical pulse. And now I'm going to move on to the respiratory. And I'm going to listen to the breath sounds. I'm going to do 8 on the front. So 1 full breath will be 1 inhale and then 1 exhale. So every time I put my stethoscope on, will you take 1 full breath for me? All right, and everything sounds normal and clear on that side. I'm going to have the patient turn for me, and I'm going to do 10 auscultations on the back. And again, every time I put my stethoscope down, I need you to take a full breath for me, okay? Okay, perfect. And breath sounds are clear, unlabored breathing. The spine is vertically aligned. There are no lesions on the skin. And now I'm going to move on to my abdominal assessment. So I'm going to have the patient lay down on her back for me. When I'm doing an abdominal assessment, I'm going to inspect and then auscultate, percuss, and then palpate, because you don't want to alter any of the gastric sounds. And we're going to start in the right lower quadrant, moving around to the left lower quadrant in kind of a box shape. And I'm looking to see if there's any distension or any concavity of the abdomen, which none is present. So I'm going to go ahead and listen. I'm listening for 5 to 30 bowel sounds in each quadrant. And if I didn't hear anything, I would listen for 5 full minutes. Typically, I would listen to each of the bowel areas for a full minute. And then now I'm going to percuss. I would percuss each quadrant, and then I would follow with circular motions of the palpating, and I'm not feeling any distension or abnormalities. Does it hurt when I touch any area?
No.
Okay, perfect, and this is normal. And then next I would move to the genitalia area. I would palpate for the femoral pulse, and I would look to see if there's any tubes like a catheter or any inflammation or anything abnormal, which there's not. And now I'm going to move to the lower extremities. I'm going to do the same as the upper extremities and feel both sides. Temperature is uniform, moisture is normal, no abnormal sweating or dryness. And then I'm going to check for capillary refill. Perfect. And now I'm going to palpate for the popliteal pulses, the posterior tibial, and then the pedal pulses, all which are bilateral ×2. I'm going to have you push against my hands for me. Perfect. And then can you point your feet, pull them up, great, and then move them side to side. All right, can you put your knees to your chest for me? All right, and perfect. All right, so I'm going to have the patient stand up. Now we're going to assess for gait. So I'm going to have the patient walk forward for me, and then walk back, and her gait is normal, doesn't need any assistance. And now we're going to check for balance. I'm going to have you close your eyes with your feet together, hands by your side. I would stand near in case you got dizzy and lost your balance. I would do this for about 20 seconds, which you can open your eyes, and that's all normal. And now I'm going to check for the range of motion of the upper extremities. So can you squeeze my hands for me? Perfect. And can you bend your elbows? All right, and how about push up? All right, can you push down? All right, can you raise your arms above your head? Great. And my assessment would be done, and then I'm going to document my findings.